I'm Dr. Richard Buckley here at MilfordMD. This morning's project is we're working on our patient's upper back. There's a bumped up area between my fingers here, which is a sebaceous cyst. There's an area above that which is dented in a bit, and so it's scarred, and it has lots of little openings, and it's also white as compared with the normal tanned skin, and so kind of easily seen. So how many, well, we won't say how many years. So when did you first have some issue in this area?
When I was a teenager.
As a teenager, and you're older than that now?
A little.
Yeah. And so what happened, and how does it bother you?
When I was a teenager, kids would tease me, so the doctor decided to use cryosurgery. For
blackheads and stuff coming out?
Yeah.
Okay, so froze it?
Yeah.
Okay.
And there was big blisters that I walked around with for weeks.
Okay.
And then it never looked nice ever again.
Your whole life?
Yeah.
And so we talked about various options. You know, if something is bleached out white, whether it's from a scar or something that caused depigmentation, maybe even vitiligo, then you have to maybe decide, what to do with the area. If the skin is smooth, you could consider trying to repigment it with an excimer laser at 308 nanometers, or a device called Relume. You can get some pigmentation back. We can also take skin from areas such as behind the ear and take the melanocyte cells and do little plugs, and then they can get themselves situated, and then the melanocytes can kind of spread and help to make some pigment in areas that were denuded of pigment. In this case, we still have a cyst here, we still have all kinds of openings here, with lots of scar tissue and irregular areas. So I suggested the best thing to do was just to cut all of this out, get rid of the cyst, and make the skin smooth, and then put those edges together. I could just do that with sort of a standard ellipse. Nice if you can do things along the lines of relaxation, or STL lines they're known as, which are typically perpendicular to muscles. On the back they run this way, on the face they run all different kinds of ways. On the arm you have a crease this way, little lines this way, so it's nice to orient excisions in that direction if one can. This one happens to be at an angle, so what I'm going to do with this is geometric closure, and that kind of looks like, somebody said teeth, yeah, or it's like a continuous W or continuous M, so it's known as M-plasty or W-plasty. And so you can see how that looks now. I'm going to make these little puzzle pieces, and then I'm going to put the puzzle back together again. And I think the end result of that's going to be the skin will be smooth side to side. All of the lumpy bumpy stuff and the exit points of whatever goo is coming out, those will be gone, and the cyst will be gone. And if something heals up with a straight line or a slightly curvilinear line, has a particular appearance to it, actually if things heal up sort of zigzag-ish, then they blend in very nicely, and they become very difficult to see. So that's why I chose to do this geometric W-plasty, M-plasty closure. So I'll show you a little bit more in a few minutes. I'm just going to go ahead and carefully excise this. First thing is to create the puzzle, and everybody's different, and everything we're trying to do is different. So I needed to figure out exactly how this puzzle was going to look as a first step. So those are the pieces to the puzzle. Now I need to go ahead and cut the puzzle out and then put the puzzle back together again. As they get to be very long, and they are sometimes, then one has to be actually extremely careful to put the pieces back together and not get off a notch. Yeah, so it can be challenging. Stay tuned.